Hello, I'm Dr. Dan Wilgus. I would like to thank you for donating your time and energy to the Oklahoma Mission of Mercy. In this video, I'm going to go through what you can expect when volunteering during this event. As a volunteer in the Triage Clinic area, the goal is to relieve pain and address the most urgent needs. Please remember that this is not like doing dentistry in your office, where more options are available and the patient has access to a dentist frequently. When you arrive to Oakmont, please grab your name tag and t-shirt from the registration desk. From there, you will go to the triage area of the clinic. Look for a volunteer wearing a blue t-shirt. Volunteers in blue t-shirts are area leads, and all other volunteers are in black. The triage area lead will lead an orientation with the newly arrived volunteers. When patients come to the triage area, they will have their patient health form, a chart with their personal information. You will fill out the chart during your examination. When writing on the patient's chart, use only blue pens. Do not use abbreviations. They may not be universal. Some patients may have differing priorities than you in terms of their treatment. Chart the exam by indicating the work that is recommended to be done in the priority of treatment sections on the patient health form. If a patient does not wish to have a certain recommended treatment done, indicate with "patient does not want" by recommended treatment. On the chart, circle the tooth numbers within the priority that need attention first. Please refer to your area leads as needed to make sure your recommended treatment is available. Teeth to be extracted include visibly non-restorable teeth, painful or infected teeth that do not fit the Oakmont protocol for endo treatment, third molars only if visible on clinical exam and or carious or causing acute pain. Limited endodontic treatment will be available and considered based on the following: anterior tooth with sound coronal tooth structure, posterior teeth, not including molars, with sound coronal tooth structure, tooth exposed during excavation and meeting the above criteria. In this case, the PA of the tooth must confirm that endo can be completed on the tooth. Patients routed to endo, restorative, or oral surgery areas of the clinic will receive an X-ray as needed. You can also request one if it aids in diagnosis. You will determine if a patient is healthy enough to receive treatment. Patients on ASA or Plavix can be treated for extractions. Patients that have been off of Coumadin anticoagulants for 3 days prior to treatment may receive extractions or other surgical procedures. Patients not off of their Coumadin or anticoagulants must show their current INR card during the medical screening process. If the card is more than 3 days old, complete an INR test. If a patient is on bisphosphonates such as Iridia or Zometa, routine dental care may be provided. Local anesthesia can be used as necessary. Avoid dental extractions if possible unless Class 3 mobility exists. If a patient has a heart stent, they cannot receive treatment before 3 months post-op and no pre-med. If a patient recently had heart surgery, they may receive no treatment before 6 months post-op and pre-med only on a case-by-case basis. A patient may not be treated if their blood pressure is higher than 180/100. The cutoff for blood sugar is 300. No elective treatments are provided to pregnant patients. Patients not passing the minimums should be escorted to the exit interview table. Mark the patient health form as "not treated" with the reason why. Turn the form into the patient exit interview table. On the patient health form, print and initial your name where directed. When the exam is complete, have a runner take the form and the patient to the routing table. The routing table is the next step after triage. This is where patients will receive cards telling them where to go in the clinic to receive treatment. When triage is complete for the day, dentists should move to the clinic floor to relieve others. Patients are not allowed to walk unattended on the clinic floor. You must use your station cards for moving patients or other issues you are having. The cards are as follows. The green card means "bring me a patient." The red card means "take the patient away." The yellow card means "a translator is needed." The white card with a red cross means an EMT is needed. The orange card means I have equipment concerns, and the blue card means I am leaving for the day or I need a break. Our goal is to relieve pain and address the most urgent of needs. The greatest gift we can give our patients is our care. Thank you for volunteering at the Oklahoma Mission of Mercy. We could not provide this free, life-changing dental care to our neighbors in need without you. I look forward to seeing you at Oklahoma.